Hello, I'm Emma Howard and I'm joined by Dr Su Laurent, who's a consultant paediatrician at Barnet Hospital in Hertfordshire. Hello, Sue.
Hello, Emma.
I have a question here from a parent who says their daughter gets a lot of joint pains and sometimes can't do PE, which she absolutely loves. What could these be due to? So what do you think the joint pains are related to?
Well, joint pains are interesting and they're divided really into two. One is the sort that are not worrying at all and are common, and we'll talk about those in a moment. And the others are the sort which parents worry about, the sort of arthritis type pains, and there is a small group of children, it is unusual, who can get a sort of arthritis.
It's what we'd worry about though,
Which
whether it's a small group or not, the
exactly,
parental fear.
Exactly. So how can we tell the difference? Well, the sort of pains where you should be seeing your doctor particularly are the pains where your child is getting redness, swelling, increased heat in the joints. Those pains, there's no doubt you should go and see a doctor, and your daughter's going to need to have some tests.
And you can see those signs for yourself.
You can see them for yourself.
You can feel the heat coming off the joint.
You can feel them. You can see them
swell.
looking swollen. You can see them looking red. There's no point telling you on television what to do. You just have to go to your doctor, and they will probably do a number of different tests to try and work out what it is exactly that's causing it. But the other sorts of pains which are much commoner are the sort of child who says, my joints are really hurting and my knees are hurting and I'm finding I'm having difficulty doing PE, and then you look at them and they look fine, and the doctor examines them and they've got a full range of movement. And in fact, interestingly, these children often have more than a full range of movement. They've got hypermobile joints. And if you look at how far backwards their arms can go, they kind of bend right backwards. If you look at how they can get their thumbs back down, they can often get the thumbs right back down on their arms. You often have the sort of knees that kind of go a bit backwards. And these children actually have hypermobile joints, and as they're doing their PE, they're actually slightly overstretching all the time and then getting achy as a result. The advice I give here is that this will get better in time, so that we all stiffen up in time and these pains get better. But in the meantime, try not to overstretch the joints. So for the person who's really good at PE but is getting a lot of pain in their joint, they may have to just hold back for a while and try not to overstress their joints.
Thank you, Sue. Good advice as always. If you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.